Hi guys, Dr. Sagar Abhichandani here. Before the year ends and 2022 ushers in, I wanted to highlight and stress upon something important but alarming. Before we start, listen to this quote. No physician, however careful he/she is, can tell what day or hour he/she may not be the object of some undeserved attack, malicious accusation, blackmail, or will be sued for damages. This quote from a reputed journal coming from the United States of America, written 135 years ago, should be an eye-opener for all. Last few years, reports of violence against doctors, sometimes leading to hurt or murder, are making headlines across the world, and even India has not been spared. In about 60 to 70% of the cases, such violence took the form of either verbal abuse or an aggressive gesture. Very often, those who abused a medical person were patients themselves who were under the influence of alcohol and drugs and were in the psychiatry wards. Increased risk of violence was also recorded when a general physician was on house calls, particularly at night. More often than not in our country, patients by themselves are not violence makers, but their relatives are. Sometimes, unknown, apparently sympathetic individuals, political leaders, political parties take the law in their hands. One of the important dimensions of violence to the doctors in government and corporate hospitals is the feeling of wrongdoing by the doctors for financial gain or for avoiding his or her duties. Anxiety, long waiting period before the patient could speak to the doctor, the feeling that doctor is not giving enough attention to his or her patients creates frustration, which gives rise to violence. Majority of the hospitals in India do not have good grievance addressal system in place. Legal procedures in India also takes an inconsiderably long time. For government hospitals and primary healthcare sectors across the country, violence by patients' relatives, local goons, political leaders, and even by police has been reported. Let's try to find solutions. Number one, what a doctor can or should do to avoid violence. A doctor should understand some of these patient-related characteristics which may be associated with violence. Heightened anxiety about the disease as well as the finance needed for the disease seems to be an important component of initiation of violence, and the doctor should train himself or herself for anxiety alleviation techniques. Young patient under serious condition, only earning member in the family, only child with a serious disease, evolve emotional outburst which may quickly end in violence. Doctors should have better training to tackle these situations. Long waiting hours and doctors' behavior towards patient and their relatives are important contributors to aggression and need to be addressed by the doctor as much as possible. Doctors probably should try to optimize and reduce the long waiting periods for the patients in the waiting room and try to improve patient contact as much as possible. For example, it has repeatedly been seen that long queues in the hospital, lack of communication from the doctors, opaque billing systems are important predictors of violence in our country. Both digital and mobile technology can substantially help in this area. Number two, what the hospital or a clinic should do. Hospital clinics can do much to reduce the violence. In government setups, this can be done as part of general reform for the hospital services in the form of improvement of services in a global fashion, employment of adequate number of doctors, and other steps to ease the rush of patients and reduce the long waiting hours. Use of computer and internet technology. Hospital security should be strengthened and it needs to be properly interlocked with the nearby police stations. No arms, ammunitions by patient, relatives should be allowed inside. There should be transparency in the rates of different investigation, rents and other expenses of the hospital, and a proper complaint redressal system. Number three, what the patient's family and society at large should do to prevent the violence. There's a huge responsibility of patients, their relatives, and society at large to prevent this violence. Dispute between patients and hospitals or doctors are not to be sorted through violence. We live in a civilized society. There are avenues of dispute redressal which should be used. Modern medicine is neither cheap nor 100% effective in curing the disease in all cases. There should not be under expectation on the outcome of the treatment in a serious case. Some patients will make it, some patients will not make it. This has to be clearly understood. Remember clearly, vandalism and violence in a hospital or a clinic is a criminal offense, and any civilized society should have low tolerance for such acts. Hardly social leaders are seen to condemn such violence today, and surprisingly, sometimes they even try to justify it. Next will be the responsibility of the media. It is the responsibility of both print and electronic media not to sensationalize the news. Medicine is not black and white subject, and so also its management. Diagnosis of a patient is essentially hypothetico-deductive process, and with new evidence through investigations and knowledge, the diagnosis of some of the cases continues to be refined. However, whatever the diagnosis be, the management of patient generally includes such uncertainties into account, and treatment continues. Last but not the least, responsibility of the government and the political parties. In India, the cause of violence against doctors is multi-layered. Spending around 1% of the GDP by the government in a population which increased 5 times since independence is not enough. Modern medicine is progressing by leaps and bounds, but most of the medical dental colleges and hospitals in the country could not keep pace with the progress. The government needs to put the efforts to see how the overcrowding in the hospitals can be prevented. No nation can build hospitals for 1.2 billion patients, but it is possible to build hospitals for citizens who are at large healthy. Nutrition, immunization, health education, pollution control, personal hygiene, access to clean water, unadulterated milk, unadulterated food, facilities for exercise, playground, etc. are the basic requirements. The government should concentrate its activities on preventive medicine. The government should punish unlawful behavior of anybody who harms the doctors and vandalizes the hospitals. So my dear friends, let's stand up for a cause. Let your voices be heard. The least you all can do is share, reshare and repost so that maximum people realize what shame violence is, especially against those same healthcare workers who have sacrificed the last 2 years of their life serving mankind against COVID. The fight against COVID is not over, but the beating a doctor gets has to stop. Stop violence against doctors. This has to end, and only then a happy new year will begin. Dr. Sagar Abhichandani signing off. See you on the other side. Take care.